member for Richmond.
Thank you so much, Deputy Speaker. And I too rise to speak in support of the Health Legislation Amendment Prescribing of Pharmaceutical Benefits Bill 2025. And this bill is about making sure Australians can get the medicines they need when they need them without unnecessary barriers standing in their way. And it really builds on our government's investment in healthcare and Medicare over the past few years. And of course, as we've heard from many of the speakers, we did have a decade of neglect under the Liberal and National Party when they were in government. It's taken a long time to build back and invest in Medicare and in health services. And this bill today is all a part of our reforms to make sure that people can access healthcare when they do require it, and it particularly for those in rural and regional areas. And our reforms have made a huge difference, and I'll go through some of the details later on about that. And this bill proposes amendments to the National Health Act 1953 and the Health Insurance Act 1973 to enable authorised nurse prescribers to prescribe certain medicines under the PBS. And of course, under existing law, prescribing rights are confined largely to medical practitioners, dentists, optometrists, endorsed nurse practitioners and midwives. The reforms in this bill mean that nurses be empowered to provide this care directly to the community, reducing the need to visit a GP or attend hospital emergency departments as well. It'll make a huge difference. And the reforms in this bill support the broader health workforce reform agenda of ensuring that health professionals are enabled to work to their full scope of practice. For a health professional, scope of practice means the activities which they are competent and authorised to perform. Now, as identified in the Strengthening Medicare Task Force report and the subsequent Unleashing the Potential of Our Health Workforce review, removing barriers and increasing incentives for all professionals to work to their full scope of practice is necessary in delivering better health outcomes. And these reforms recognise that while our registered nurses are highly educated and skilled, their skills have been underutilised in the primary healthcare system. And they also recognise that empowering nurses to work to their full scope of practice will strengthen our healthcare system by removing barriers, easing pressures on the workforce and building long-term capacity and sustainability. Now, under state and territory legislation, some nurses are already prescribing medicines, particularly in primary care, community health and regional settings. But without PBS prescriber status, their patients are forced to pay full price for their medicines. Two patients with the same condition seeing two different qualified health professionals should not face different out-of-pocket costs simply because one prescriber is recognised under the PBS and the other one is not. This bill closes that gap by creating a new category of prescriber under the PBS. The bill also contains very important safeguards to ensure that only nurses with appropriate training and professional qualifications are in fact authorised to prescribe. Improving access to healthcare has been a key priority of the Albanese Labor government. We know the demands on our health system continue to increase. We have an ageing population and a growing number of people living with complex and chronic conditions, and it has been at the heart of so much that our government has done in reforming healthcare and providing more services. And the changes that we referred to today in this bill build on the work that we've done to deliver cheaper medicines, stronger Medicare and just greater access to healthcare across the board. In fact, just recently our increased hospital funding, record funding, another initiative of our government that's making a huge difference. Now, of course, in 2022 we reduced the eligibility threshold for the PBS safety net to ensure that even more Australians had access to cheaper medicines and lower out-of-pocket costs. This included a 25% reduction in the number of scripts a concessional patient must fill before the PBS safety net actually kicks in. We further slashed the cost of medicines in 2023, making the largest cut to the cost of medicines in the entire history of the PBS. This was the first time in 75 years that the general patient copayment was reduced and saw the maximum cost of a general script falling about 30% from $42.50 to $30. We also introduced the 60-day prescriptions to enable Australians with chronic or ongoing health conditions to get twice the medication on a single prescription. This means a reduction in the amount that people pay for medicines, fewer trips to the doctor and, of course, fewer trips to the pharmacist as well. And we froze the cost of PBS medicines for pension and concession card holders so that prices will stay at a maximum of $7.70 until the end of the decade. Now, for areas like mine, we are very fortunate to have a high proportion of seniors in northern New South Wales. This makes a huge difference to have that certainty that it is $7.70 that they will be paying. And so many locals have told me the difference that makes to them and to their health care. And of course, starting from the 1st of January this year, we delivered even cheaper medicines for all Australians by reducing the PBS general patient co-payments for general patients from $31.60 to $25. So low, so low. Now, of course, in my electorate of Richmond on the north coast of New South Wales, I'm very proud to have delivered on my 2025 election commitment, which was that a re-elected Albanese Labor government would deliver a Medicare urgent care clinic in the Tweed region. And when I was campaigning, people were very keen to have this in place, knowing how well the urgent care clinics, the support they provide and the difference that it makes. And of course, when we talk about the urgent care clinics, we say all you'll need is your Medicare card, not your credit card. That's the reality. Just walk in there with your Medicare card. And the one we have at the Tweed Heads Medicare Urgent Care Clinic is based at the Tweed Health for Everyone Super Clinic. A super clinic that was also delivered by a previous Labor government and provides wonderful services for the community. And the Urgent Care Clinic provides locals the free urgent care they need, fully bulk billed, and it's open 7 days a week from 7:30 a.m. to 7:30 p.m. Now, we officially opened the Urgent Care Clinic last December, and since then, so many locals have told me that it's really filled a very crucial gap in providing healthcare services in our community. And I've been told that since it's opened, there's been a daily average of 38 presentations. They have been incredibly busy providing that service and is making a massive difference. And nearly 60% of patients who visit the Tweed Heads Urgent Care Clinic would have otherwise gone to an emergency department to access the care they need to the Tweed Valley Hospital. So this shows this clinic in Tweed is easing the pressure on our local hospital, and that is the feedback that I'm getting from health professionals, from locals. It is making a massive difference for so many people, and many locals and seniors and families. Now, of course, we're also delivering access to free walk-in mental health care for locals, with planning underway for a Medicare mental health centre in Tweed. The centre will be open for extended hours with no appointment or referral needed to access those services. And of course, we a number of years ago we opened the new Headspace in Ballina that's providing important support for younger people. We have an existing one in Tweed Heads which does a remarkable job as well. But it's important that we have all these services here, and as I say, that planning's underway for the Medicare Mental Health Centre. Make a huge difference in the community to have that operating. We're also delivering on our election commitment to expand bulk billing, and this has been an absolute game changer in my electorate and across the country. It's as part of the single largest investment in Medicare since its creation 40 years ago. For the first time, Labor has expanded bulk billing incentives to all Australians and created an additional new incentive payment for practices that bulk bill every patient. We've tripled the bulk billing incentive for people who need to see their GP most often, pensioners, concession card holders and families with children. And since the 1st of November 2025, we expanded those incentives to all Australians. And it has been a huge success in my area, I know, right across the country. We also introduced a new incentive payment for practices that bulk bill every patient. Since November 25, a new bulk billing practice incentive program is supporting practices that bulk bill all their patients. This is on top of the bulk billing incentive. So fully bulk billed practices receive an additional 12.5% loading on their Medicare rebates. And Deputy Speaker, last year, towards the end of last year, I visited the Wollumba Medical Centre in Murwillumbah, where GPs then informed me they were universally bulk billing, and that was due to two reasons. First of all, our increases to the bulk billing incentives, but also another major change that our government made, and that was reclassifying the town of Murwillumbah from metropolitan to regional for healthcare services. And I want to again acknowledge all the community that worked so hard to make this happen. The fact that the previous Liberal National government had classified it in that way as a city really inhibited a lot of people's capacity to access healthcare. So we changed that. And special thanks to the Health Minister for that, having that change. is so important. So that, combined with our bulk billing incentives, mean that places like the Wollumbin Medical Centre fully bulk bill everyone. I also invited the Minister for Health back to the North Coast in October to visit the Tweed-Benora Medical Centre in Tweed Head South and speak to GPs who also started bulk billing all their patients on the 1st of November. So thanks to all these changes that our government's made, we now see right throughout the North Coast these wonderful signs on front of GP practices, Medicare bulk billing practice. How great is it to see that sign? People know it's there, they know they can go in, they know they'll be bulk billed. And those signs are now on front windows of more than 20 bulk billing practices, so it has expanded very quickly. And that's going from Tweed Heads to Byron to Ballina, right throughout my electorate. We're seeing more and more practices that are fully bulk billing. And of course, on 1st of January this year, we also launched 1800 Medicare, a free nationwide 24/7 health advice line and after-hours GP telehealth service. And of course, now we're seeking to make healthcare even more accessible through all the measures that we have in this bill. This will also make a huge difference, the reforms that are contained within this bill. And it's important too because registered nurses are the most geographically dispersed health profession in Australia and comprise around half of the entire Australian health workforce. And by enabling authorised nurse prescribers to prescribe certain medicines under the PBS, people will be able to get better access to medicines closer to home. They won't have those associated costs with travelling further to see a doctor, and the delays in waiting for an available appointment will all be reduced. Again, this will also be another game changer when it comes to delivering health care. And of course, preventable hospitalisation that are a result of delayed access to medicine will also be reduced as well. And these reforms are the result of work already undertaken to improve access to timely, affordable and safe medicines and alleviate pressure on our health workforce as well. And of course, there's been extensive research and consultation that's been led by the Nursing and Midwifery Board of Australia and the Australian Chief Nursing and Midwifery's offices. This work led to the development of new standards for designated registered nurse practitioners. And in December 2024, Commonwealth, State and Territory Health Ministers approved the new registration standard to enable nurses to become authorised prescribers. So from July 2026, it's expected that the first cohort of nurse prescribers will complete their additional education and receive endorsement. And that's just great news, particularly, as I say, for those of us in regional and rural areas. And the reforms in this bill help align our health legislation with modern clinical practice. They strengthen patient access to subsidised medicines and support the evolution of the health workforce. And of course, the bill complements existing practice by enabling a broader range of health providers to contribute effectively to patient care. And this is very important in contexts where medical workforce shortages can lead to delays or inefficiencies. And ultimately, this whole bill is about putting patients first, and that has been our whole agenda with all of our healthcare reforms of making sure we are putting patients first. It also, very importantly, recognises the skills of our nurses, and I do want to compliment all of our nurses in my region and across the country, but in my region, those nurses and health professionals for the remarkable work that they do, continue to do all of the time, and this is a recognition of that. So it recognises the skills of our nurses, trusts the evidence and remove barriers that just, quite frankly, don't make sense. It doesn't make sense that this has not been in place before. And it's about ensuring that where a person lives or which qualified health professional they see doesn't determine whether they can afford the medicines that they need then and there. And by modernising our laws to reflect contemporary practice, we're strengthening Medicare, supporting the health workforce, making our health system more responsive, more equitable and indeed more sustainable into the future, because we do have that ageing population, we do have increasing clinical and complex care needs that are there. So these investments right across the board are vitally important. And Deputy Speaker, I commend the bill to the House. Yeah.